So what could be the issues related to loss of function? Could have breathing, eating, and speaking difficulties, which does impair on their long-term quality of life as well. So that was the theory. So let's look at how the data actually unfolded. This was the Veterans Affairs Laryngeal Cancer Study Group and the URTC trials, which looked at surgery versus induction chemo prior to RT for laryngeal preservation. And as you can see here, there's absolutely no separating the curves here as far as looking at the survival or overall survival is concerned. Induction followed by radiation did not compromise disease control or survival, and the key point is about more than 50% of these patients could retain their larynx and probably require even salvage surgery later on. So that's probably why I'm saying the hypothesis is concerned. And let's look at the GOTEC study. This is a French study looking at 3 drugs versus 2 drugs as far as induction chemo is concerned. We definitely know that 3 drugs is much better, where you're looking at TPF versus just a platinum and 5FU. And the laryngeal preservation rates were much higher when you did a 3-drug regimen. So that probably is gold standard. And this was yet another interesting publication that came out of Tata Memorial Hospital, TMH, and where they looked at the incidence and impact of DPD testing and whether that could predict for toxicity. So definitely yes, if you're talking about a 3-drug regimen probably being more toxic, well, you have a way of looking at countering that by doing a DPD assay for all of these patients and then selecting your 5FU regimen based on that. So definitely rules out toxicity. Well, this is data again that we all know from TAX 3 to 4. We're looking at 3 drugs versus 2 drugs as induction, followed by chemoradiation, which is carboplatin with RT. And definitely, well, we could see that there's a definite improvement in the survival and PFS and overall survival as well. So it's just not about having a superiority complex. Did show that this was definitely superior. And going by the HPV status as well. Remember, we know that HPV positive malignancies, as far as oropharyngeal malignancies, have a separate staging system, and also they have much better prognosis as well. So I think it's time for us to look at de-escalation and escalation protocols even in that context. Well, then I'm sure my colleagues and my opponents will definitely point out this study, the RTOG study, which did show that there was a higher laryngeal preservation rate with just definitive concurrent chemoradiation alone. So should that be the standard of care? And I'll tell you why, because it gets glossed over, a lot of things get hidden. So concurrent chemoradiation did improve on the laryngeal preservation rates, but what the study also did show us was the deaths unrelated to laryngeal malignancies or treatment, meaning the toxicity related deaths were much higher in the chemoradiation arm. And again, we know that a trope drug regimen is definitely not an ideal thing in as far as induction chemo is concerned. So let's look at it a bit more closely, shall we? And let's look at the survival based on deaths from primary laryngeal malignancies. Well, you can clearly see here that chemoradiation arm did have a lot of deaths that were probably unrelated to malignancy and probably related to the toxicity, which brings our mind to the question, is it safe? So look at that, the incidence of toxicity based on this RTOG trial, which we always keep harping upon, saying that probably concurrent chemoradiation is the way to go. Look at that, 40% severe late toxicity. And this is not just about immediate toxicity. Remember that radiation can have long-term toxicity and late toxicity as well, which was probably covered under the snow as far as this trial was concerned. So toxicity, to me, definitely a major concern. Let's look at the trampoline data again, looking at cetuximab plus radiation or chemoradiation after an induction with a 3-drug regimen. And that's how this data went. Well, the toxicity, well, pretty manageable on both sides, pretty evenly balanced as well, even with a biological agent like anti-EGFR, cetuximab plus RT. And look at the laryngeal preservation rates here. Definitely higher and definitely doable as far as doing cetuximab plus radiation after a 3-drug regimen. So I think this was probably for the surgeons. I think prior to COVID, they were all too busy, and now probably post-COVID, they're probably looking at doing surgery for any patients. So this is yet another interesting trial called the HNN-07, which is actually looking at trying to answer all these questions, where they looked at induction followed by chemoradiation with either cisplatin 5FU or cetuximab plus radiation, and with and without induction. So that's probably the last nail in the coffin, and clearly this trial did show an improvement in survival with induction chemotherapy. There was a clear separation of the curves, and also the median overall survival difference of close to 2 years improvement in the overall survival. So I think we have definite proof. The proof of the pudding lies in eating it, and there we have the trial that has shown that we do have a trial that has actually improved on the survival as far as induction chemotherapy is concerned. So, and also when you look at induction followed by chemotherapy versus cetuximab plus radiation, cetuximab plus RT did seem to fare better when you have a 3-drug regimen and follow it up with that. So as far as organ preservation strategies are concerned, those are my conclusions. So there are definitely improvements in laryngeal preservation rates when you have a 3-drug regimen and when taxanes are added to your PF. Chemoradiation did show a higher laryngeal preservation rates based on the RTOG study, but remember that came at the cost of higher toxicity, and also there was an increase in the in deaths which were unrelated to laryngeal malignancy or deaths due to toxicity. And cetuximab plus RT, like I showed you from the HNN-07 trial as well, definitely is here to stay. So, I think, we all know that there are great organs, but, we should look at trying our best to look at organ preservation as the way to go forward. So with that, I'll conclude and I'll come back with the rebuttal. Thank you.